Hi, everybody. Welcome to the second part of our metabolism lecture. So last time we focused on looking at the breakdown of metabolism, which is catabolism and anabolism. We also described how your body produces ATP during the process of glycolysis, Krebs cycle, and electron transport chain. Do keep in mind that when we're talking about electron transport chain, which is basically produces majority of the ATP in our body, we do require oxygen presence as an electron acceptor, and without that, we will not be able to produce as much ATP. Now, to start with, or to continue what we've described, we're going to look at this chart. Again, something kind of highlighting the same information. Glucose going through glycolysis, which leads to production of pyruvate, going through the Krebs cycle, electron transport chain, and producing about 36 ATPs. And again, some people may kind of debate that. They say between 34 to 36. We're not going to get into that detail. So we're going to keep our 36 numbers. Now, what happens, again, if we do not have access to ATP? So, not access to oxygen, not ATP. So you go through glycolysis and you produce your pyruvate. Now, what was the product of the pyruvate? So kind of reviewing this. When you do pyruvate, other than ATP that you produce, you're also producing 2-NADH, right? So as you're producing this, right, and there is no oxygen, the pyruvate will not be able to go through this process. So this process is basically out, right, when you do not have access to the oxygen. So as the body is trying to find a way to produce ATP, right? Here's the really important thing, guys. As your body is trying to find a way to produce ATP without relying on your mitochondria and the electron transport chain, it says, okay, I'm going to rely on glycolysis as the main mechanism for me to produce ATP. Yes, it only produces 2 ATP, but 2 ATP is better than no ATP. So in the absence of oxygen, pay attention to this, guys. In the absence of oxygen, your body relies on glycolysis as the main mechanism to produce ATP. That's its purpose. But here's what happened. If you continue to produce ATP using glycolysis, you also will be producing 2-NADH as the byproduct. Now, this 2-NADH that we described is not going to go anywhere, right? It's not going to be recycled, because for recycling NADH2s, what did I need? I needed electron transport chain to go through this whole process, right? So my NADH becomes NAD plus and can basically be reused. So as I am actively utilizing glycolysis as a main mechanism to produce ATP, my NADH level, pay attention to this, my NAD plus levels are going to decrease, and my NADH levels are going to increase, right? You don't have an unlimited number of NAD pluses, right? So as you are holding on to those electrons, as you go through the glycolysis process, and you're not recycling them, your NAD plus numbers are starting to decline because all of them are basically stuck with their electrons. Kind of imagine them if you have taxis or shuttles, right? Your shuttle is empty, that's NAD plus. They pick up their electrons, right? And they go drop them in their final destination, which is electron transport chain. Now they're empty again, and they can come back and pick up new electrons. Now imagine the shuttle goes, pick up the electrons, and then they're stuck in their final destination. They can't go anywhere. Therefore, they cannot pick up new passengers. So what happens to the taxis that are empty? Your NAD pluses, their number is gonna decline. Now, why is that a concern? Why would I care? Because remember, if I want to be able to do glycolysis, what do I need to give? I need to give NAD plus to be able to produce the NADH. So because my NAD plus numbers decline, that means what? My glycolysis is eventually going to shut down too, right? So what is the solution? The solution is your body says, I want to, here's the keyword, guys, I want to recycle my NADH to back to what? To NAD plus. I can't use my electron transport chain. So what is the other option I have? Your other option will be what? Fermentation. So fermentation is going to do what? Pay attention to this, guys. This is really important. Fermentation is going to take the pyruvates and convert them in our body to lactic acid. And this is undergoing this process is also going to recycle your NADH back to what? NAD plus. Now, what happens to your NAD plus numbers? They start to go up, which means what is your body can do now? Continue the process of glycolysis and produce that 2 measly ATP to keep the things going. So if I ask you, what is the purpose of glycolysis in an anaerobic process or in absence of oxygen? The purpose of glycolysis is to produce ATP. If I ask you, what is the purpose of fermentation? It's not to utilize pyruvate, it's not to utilize and produce ATP. The purpose of fermentation is to recycle NAD plus. Okay, make sure you guys can make that distinction. What's the purpose of glycolysis? What's the purpose of fermentation? Two very different functions. Now, again, imagine your body has undergone limited amount of oxygen, so you relied on an anaerobic process. But eventually, your things are going to go back to normal, right? Your access to the oxygen is going to go back to normal. So now you're stuck with all of these lactic acids, right? Which was a byproduct of fermentation. And what are you going to do with them? So what your body does is undergoes a process called the Kuri cycle. So what is a Kuri cycle? So here is what you have done when you had limited oxygen. Anaerobic process, you went through glucose, glycolysis to produce your pyruvate, and then lactic acid or lactate to release or recycle your NAD+. When your body is returned back to normal, your muscles, which are the common place you're going to do this process to produce ATP, take the lactate, sends it through the blood to your liver. One of the 500 functions your liver does is to literally take the lactic acid and revert it back to glucose. So it literally reverses the process within here. It takes the lactic acid, converts it to pyruvate, and then eventually to glucose. Very fun, right? Here's the main difference, guys. For pyruvate to be converted back to glucose, you actually require to input 6 ATPs, right? So you're gonna basically use a lot more ATP to revert it back to glucose. But remember, you cannot really do anything with lactate, so you really need to get rid of it and convert this to something useful. Now, what can you do? The glucose that is produced can either be stored as glycogen, right, the more complex version, or you can literally transfer it via blood back into your muscles, and your muscles can effectively utilize that. So this is a Kuri cycle, basically to allow your body to recycle the pyruvate back to glucose. Now, if I ask you what's the main source of nutrients for your body, your answer should be glucose, right? Because you maintain glucose, it's part of the homeostatic feedback. It is the most important type of molecule. It's the primary molecule that is utilized in terms of energy production, etc. But what happens if your glucose level is low, but your body still needs to produce ATP? So the second source of energy for your body is lipids. Now, if you recall again, the most common type of lipid we have in our body is triglyceride. Triglyceride is made up of glycerol or monoglyceride and 3 fatty acid chains. They are very important in terms of production of or the amount of ATP they produce, so they are more effective. They produce twice as much as ATP as carbs and proteins, so they're a really good source in terms of ATP production. You can store the fat in typical skeletal muscles and livers, but typically they're stored in fatty tissue or adipose tissue. Now, this picture I'm showing you here is extremely important, guys. You really need to know this very well. So I can ask you questions, specific questions directly from this picture, so make sure you guys do focus on this. So we're gonna start simple. So let's take a look at what we have in the white, on the, I guess, the left-hand side. So what you start with is glucose. Glucose is eventually becoming the pyruvate acid or pyruvate. So basically this portion right here is describing your glycolysis, right? I don't need you guys to know the glycoaldehyde triphosphate. You're welcome to know it, but basically it's an intermediate within the glycolysis. So this whole process going from here to here basically is describing glycolysis. Now, pyruvate becomes acetyl-CoA. Again, kind of thinking about it, acetyl-CoA goes through the citric acid cycle and eventually your electron transport chain, which leads to production of ATP. So, what if we didn't have glucose and we're using fat as a source of energy? So again, most common type of fat is triglyceride. It's gonna be broken down to glycerol and fatty acid. Before I go further, I do want you to understand that this is both anabolism and catabolism. As in, when your body needs to break down triglyceride, the arrows are moving down toward glycerol and fatty acid. And when your body does not require the individual components and it wants to store fat, it combines glycerol and fatty acid to form triglycerides, which is the anabolism portion of metabolism. Now, let's start with glycerol. Let's start with the simpler one. Glycerol undergoes a process called gluconeogenesis. So glycerol component goes through a process called gluconeogenesis, and that basically gets introduced as an intermediate of glycolysis. Again, I don't need you guys to know the full name. Become the pyruvate acid, acetyl-CoA, citric acid cycle, goes through electron transport chain, and eventually ATP. Now, what does this word mean? Gluconeogenesis. Break it down for yourself. Gluco implies glucose, neo means new, and genesis means production. So basically, they're telling you, you can take an organic molecule, which is in this case is glycerol, and convert it to glucose. Opposite also is true. If you have lots and lots of that intermediate of glycolysis and your body says, I don't need this right now, I don't need this much glucose in my body, what is your body going to do to that extra glucose? So, okay, I'm gonna store it for later use. What's the best way for my body to store it? Is as fat. So it's gonna take those intermediates of glycolysis and undergo a process called lipogenesis, which is basically means lipid production. It's gonna help you produce glycerol. You're also going to produce fatty acid through the same process, and I'll go over that in just a second. Combine the glycerol and the 3 fatty acid together, and you get your triglycerides. Now, what are we going to do with our free fatty acids? So first thing that I'm going to do is take those free acids and break them down to a 2-carbon, I guess, mini chain. So carbon-hydrogen chains or carbohydrates. Carbohydrogen, or hydrocarbons. I can't talk apparently. Hydrocarbons, which is basically means carbon and hydrogen. So Here's a very important word you need to know. These small chains of carbon and hydrogen, which is part of the fatty acids, are undergoing a process called beta oxidation, and they become acetyl-CoA. So fatty acids, which are basically going to be broken down to tiny chains of carbon and hydrogen, more specifically two carbon, they undergo a process called beta oxidation, and they form acetyl-CoA. Now, logically, if acetyl-CoA is needed at that instant within the liver, let's say, acetyl-CoA is going to be entering the citric acid cycle or your Krebs cycle. The products eventually go through electron transport chain and help you produce ATP. However, what if acetyl-CoA is in your liver, let's say, and it needs to go somewhere else to be utilized? So let's say your muscles. Your body doesn't feel very good transporting acetyl-CoA through the blood. So what is it going to do? It's going to take acetyl-CoA and convert it to a different molecule called ketone bodies. This process is called ketogenesis. Again, keto as in ketone, genesis production. So acetyl-CoA is undergoing ketogenesis to produce ketone bodies. Your body likes to transport ketones. It's happy with that. It doesn't care. Where the ketone bodies reach their destination, what are you going to do? Ketone bodies are going to revert back to acetyl-CoA. So look at the arrows, they're going back to acetyl-CoA. They can easily go through the Krebs cycle, or citric acid cycle, electron transport chain, and ATP production. Very important aspect of this concept. Ketone bodies are acidic, so the more of them you have, the lower your blood pH is going to be. And we'll talk about that in terms of ketoacidosis for diabetic patients in a few minutes. Now, imagine again, you have a lot of acetyl-CoAs in your system and you don't need them. Your body is not utilizing them fast enough. So acetyl-CoA can be converted into free fatty acid chain through a process called lipogenesis, exactly like what we did for the production of glycerol. And again, fatty acid and glycerol can be combined together to form your triglyceride, and that's going to be your fat deposits within either adipose tissue, your liver, or your muscle. Please make sure you guys are familiar with what the vocabulary gluconeogenesis, lipogenesis, beta oxidation, ketogenesis imply, and make sure you guys are comfortable with following this path. As in, if I ask you where would glycerol go, you should be able to say glycerol undergoes gluconeogenesis, introduces as an intermediate of glycolysis, becomes pyruvate acid, acetyl-CoA citric acid cycle, electron transport chain, and again, eventually utilized effectively for ATP production.